and will be available. Okay, I got it. And will be available on Community Action's YouTube channel. Parts of the event may be recorded and used by media outlets. At the end of the program, 7 p.m., our partner members will give announcements. All of the participants are welcome to give announcements in the parking lot, which is an unmoderated discussion from 7 to 7:30. Notice that DAT and the YWCA are nonpartisan operate organizations, and Community Action of Rock and Walworth County is an apolitical organization. We would also like to recognize that we're meeting on the ancestral lands of Native nations. No matter where you are on Native nations lands. In Wisconsin, there are 11 federally recognized Native American sovereign nations and one seeking to regain federal recognition. We acknowledge these indigenous communities who have stewarded the land through the generations, and we wish to pay respect to their elders, both past and present. And that's all I have to say, so I'm turning it over to Amy. Amy, take it away.
Thank you, Neil. And again, welcome everyone to our November Courageous Conversations. For our regulars, this evening is going to look slightly different. So we usually have 2 to 3 videos to frame our discussion, and then we have some conversation starters. There are no videos this evening. We are going to jump into the meat of what I hope will be a robust conversation. But I just want to lay out how we want to structure the evening. So we will begin with Renee Bew, who will give us a presentation on the Immigration Support Network. From then, we'll shift into education. I sent out a question about bilingual and multilingual education and services specifically for immigrants, and a few of those districts responded. We have a couple of them present with us tonight. So I will go through the responses that I received. I will yield the floor to our guest from the educational sector, and then we're going to move on to community services. Kate Luster is on. So after we wrap our conversation about education, we will shift into community services. And I am hopeful that everyone will feel comfortable to ask questions along the way. That part of our discussion hasn't changed. So if you have a question, once we get to that portion, feel free to put it in the chat and I can read it for anyone that doesn't have their chat open. If you want to unmute and share your question yourself, just drop a question mark in the chat. If you have a question that is in any way private in nature, you can direct message me. I will put the content of what you send on the table for discussion, but won't connect you to it specifically. All right. So
Amy, yes. I just want to acknowledge the presence of Devin Dion, who is with HealthNet, and that's another community service agency that is welcoming to immigrants.
Perfect. Devin, I don't want to put you on the spot, but I welcome you to chime in once we get to the community services portion of the discussion. So thank you in advance.
Absolutely. Thank you for having me.
Absolutely. Renee, it's so good to see everyone, but Renee, I haven't seen you in a minute, so it's good to see you. And I yield the floor. Please give us an update on the Immigration Support Network, and hopefully you will conclude by letting us know what we can do.
There we go. Actually, I have to click the button to make it unmute me. So thank you all for having me here. I really wish that Gina Isunso was here because she would actually be able to give you numbers and more data than I have to give you. But what I can tell you is that ever since last year when the pandemic started, we came together as the Immigrant Support Network and determined that we needed to do something in order to help the immigrants in the community who were not eligible for services from some of the organizations that were providing funds or services for people who were having a rough time, whether it was paying rent or with food, any of those kinds of things. And so working together with Faith Lutheran Church, the YWCA, a number of churches actually throughout the community, and then also ECHO, we were able to provide families, and I know it's north of 75 families with funds for groceries, gas, rent, even medical expenses and other expenses that they had during the pandemic. And again, it was especially during the beginning, but it's ongoing. And we started a GoFundMe account, and that money was used to be able to help those people in need. But also Faith Lutheran Church is a wonderful example of a community partner, and their congregation came together, and just within the first few weeks of deciding that we needed to take some action, just that one church raised over $8,000. So that was pretty incredible. And all total, and I know Kathy and I think Carolyn are here too, and they're on the leadership team also. They can correct my numbers if I misstate, but I believe all total, we raised about $80,000 that we were able to use to help immigrant families who were not eligible for other funds or other services. That the need still continues. And so we have done a couple of asks throughout the last, well, almost 2 years now, getting close. We've done a number of asks and continue to receive donations from the community and different organizations, but we will continue to have our GoFundMe account and to ask for donations and help from the community for the immigrants. Gina, and like I said, if she were here, she would tell you she continues to get phone calls, and really it's heartbreaking hearing some of the needs and knowing that there are multiple layers to this. So sometimes they're afraid to ask for help because if they're not documented, they are afraid that registering for anything puts their name out there, that it makes them more vulnerable, and that they are then potentially going to be picked up by Immigration and Customs. So a lot of people are afraid to ask because of that. A lot of people don't know what services are available. So it's really good that ECHO has the program that they do, that Faith Lutheran Church has expanded their services that they were already doing, and that the YWCA also has been a big part of getting this money. Excuse me. So donations for the money, I did just see in the chat. The GoFundMe account, I would, after I'm done talking, I'll get that link and put it in the chat. And the address for the donations, you can make the donations to, excuse me, if you want to write a check, you can make them to Faith Lutheran Church. And I will put that information in the chat also. Does anyone have any specific questions? other than those two.
Renee, just one more thing to add.
Huh?
And that
Oh,
is,
hi, Nancy.
hi. And that is that you can mail checks directly to the YWCA and indicate in the memo line, it is for immigrant services. And it will then go to immigrant services. And she provides lots of services. Transportation, if they need to go to Milwaukee or Chicago for paper processing. And almost everything that I think Faith Lutheran collects goes to the YWCA eventually. They buy gift cards, etc. And some of it is just cash to them. So either place works.
Yes, either place. And the thing though, for both, actually, I'm glad you said that, Nancy. For both places, if you write a check in the memo line, please write that it's for immigrant services, because then they will take that money for that specific program. Any other questions? Yeah, and you can make donations to ECHO also. Kathy just put that in the chat. ECHO's money specifically has gone for rent. So just so that you know that ahead of time. But again, no matter which organization, ECHO, YWCA, or Faith Lutheran, you need to make sure that you note, if you write a check, that it is for immigrant services. So Amy put the address for the YWCA in there. Thank you, Amy. Any other quotes? Susan, I see you have your hand up.
There we go. Do these services, is it just for Rock County? How far is the reach for these services?
We really, and again, my cohort from the leadership team of the Immigrant Support Network can chime in too, but we really have been trying to keep it for immigrants in Rock County because the organizations are in Rock County. I don't remember Gina specifically saying, an ECHO for sure is Rock County. I don't remember anything going outside of Rock County, but again, Nancy, Kathy, Carolyn, if I am not remembering.
I think that's right, that it
Okay.
stays in the county. And for ECHO, I think some of their services are limited to people in Janesville, but their housing services is countywide. And the and thing there is they have a lot of money from, federal programs, but some of the people that we're talking about don't qualify for that. So that's why it's nice for ECHO to have some additional money that they don't, that no strings attached, that can be used for housing assistance.
Yes.
So what I'm hearing you say is that the primary focus is Rock County, but maybe not necessarily limited to Rock County.
Yeah, I don't remember. Amy put Gina's email address in the chat also. Gina is actually on vacation right now, so taking some time off, which she definitely deserves. And she would be able to tell you for sure where the people live that have been served through those funds, through the Faith Lutheran and YWCA's funds. But it really is Rock County focused.
Thank you.
You're welcome.
So we will open questions back up at the end for anyone that we've heard from. But before we move on, are there other questions? Renee, thank you so much for giving us that information. Hopefully people are using the chat if you want to reach out and support the Immigrant Support Network. But before we move to education, are there other questions for ISN?
The other one thing I would say, Amy, that I would just like to add, if I'll put my email address also in the chat, because if anyone is interested in getting more information about the Immigrant Support Network and finding out about how they can help in other ways, they can definitely reach out to me and then I can connect with them independently. Excuse me. So we meet every other month and have speakers from different organizations. So in September, we had speakers from UMOS. So if you're interested in the Immigrant Support Network meetings, you can email me and let me know, and I'll make sure you get that information.
Sounds good, Renee. Thank you for putting your information in the chat. I'm sure that will be useful. So as we shift to education, just wanted to let everyone know that we did reach out to Beloit, Turner, Clinton, Evansville, and Milton, and did not receive a response before we started the program, but we did hear back from Edgerton, the School District of Janesville, and the School District of Beloit. So I'll just share some of the information that we got from Edgerton and the School District of Janesville. I will turn the floor over to Rosa Maria Larson, and we also have Julie DeCook. So if we could go in that order for you ladies to unmute and to share and to answer questions. I'm sure people are curious of what we're doing in our school districts to support our immigrant families. So first, I heard back from Tracy Devers, who is the Director of Teaching and Learning at Edgerton. And she wrote, in Edgerton, we have academic programming for all of our bilingual and multilingual students. This programming comes in a variety of methods depending on their EL levels. All of our families complete home language surveys at registration, and from that, it helps us to identify any new students in the school. Once identified for services, all of the students served have language plans developed specifically to meet their needs. Students are seen daily or every other day for support in attaining proficiency in English, completion of academic work, and other support needed. Okay. We did hear back. Thank you, Julie, from the School District of Janesville. Julie serves as the coordinator for the title programs. English learner services are provided to all School District of Janesville schools. Some charter schools with less than 5 to 10 students are provided consultation services. All other schools have EL teachers who provide direct services. Direct services can include co-teaching or push-in support, specific English language development classes for students at beginning and low intermediate proficiencies of English, and native language support and enrichments. So they provide family engagement during the year to get feedback and input from parents and to add to their capacity to support their children's education. So first, I will yield the floor to Rosa Maria Larson, and then we will hear from Julie Cook. Thank you both in advance.
Thank you, Amy. So I'm Rosa Maria Larson. I am the Biliteracy Instructional Leadership Coordinator for the School District of Beloit. And very similarly to Edgerton and to Janesville, we do have families come in and fill out a home language survey. And if students are identified as having another language in the home, they are screened and then provided services based on whether or not they qualify. And the services that we have in the School District of Beloit for the students are, we have three different types of services. The first one is, our biggest one is our dual language program. We have a 50-50 program that invites students who are primarily Spanish speakers, as well as students who are primarily English speakers that to share in the classroom. Half of their day is presented in Spanish, the other half is presented in English. And the idea behind that is called a two-way immersion, where the students are learning from each other. So we have that at, now we have it at 4 of our 6 elementary schools, which are kindergarten through 3rd grade. And we have a strand within the school at each of those schools. And then we have them at all 4 of our intermediates. We have a strand, which means, you know, if you have 4 classrooms of 4th graders, well, 5 classrooms, for example, of 4th graders, 2 of those classrooms would actually be participating in the dual language program. We have a lot of families that want to keep up their heritage language. Maybe the parents or the grandparents are Spanish speakers, and then families who are really interested in their children becoming bilingual. The other support that we have is English learner support. We have English as a second language teachers who support the students that are mainly the ones that are not participating in the dual language program, but also they do push into the dual language program as well to help the bilingual teachers with the students in their language development in English. And then at our high school, we have a newcomer language arts class. So the students are getting the content of language arts, but they are also getting language development. So we do have classes that are specifically for students who are newly arrived in the language arts content. We're working on adding more classes over the next few years in the high school, because that's something that, besides our dual language students needing that, our newcomers need that as well. We also have heritage speaker classes, which are for students who might be EL, maybe they're not EL, being English learners, they might not be, but they want to improve they might know how to speak and they understand Spanish. They don't necessarily know how to read or write it. So that's the help that we have at the high school. Another program that's really related to this is more for its adult literacy and ESL classes through our Even Start. We continued with that program through our Title I funding. We get federal grants for different needs, and that's the one that the school district is committed to keeping. And it's Even Start being that the parents are getting English as a second language classes, but we also have the babies birth through to 3 who are participating as well. I see a question in the chat. Is Spanish the only language in the programs? Right now it is, because that is our main language group. We do have 12 or 13 languages that are represented in our district, but we only have maybe 1 or 2 speakers for each of those languages. For them, we do provide English learner support through our EL teachers, but it's primarily in English. So.
No, I don't want that question to be confused. When you say is Spanish the only language, that's for the dual language immersion programs. But throughout the school district of Beloit at the high school level, there are other languages taught, correct?
Yes, we have our world languages program that starts in intermediate school. In the intermediate schools, it's only Spanish, but once you get to the high school, the students do have a chance of taking French. So those are the 2 languages that we offer through our world languages program, but it's not directly related to our English learner services.
Perfect. So next we'll hear from Julie, and then if you have questions for either Rosa Maria or Julie, feel free to put those in the chat or drop a question mark, and I'll call on you so you can unmute and ask your question directly. Julie, go ahead, please.
Good evening. I apologize. My voice is a little raspy tonight. But yeah, it's good to see Rosa Maria. We've worked on a lot of things together. As she described, and as you already read what I had submitted, we do have a range of services. We also offer the Heritage Spanish program at the high schools and have added AP Spanish literature to that to extend those opportunities a little further. Our demographics are a little different in Janesville, so we have many Spanish speakers, and our newest immigrant students are mostly from Honduras, which really they're refugees, whether technically identified as that or not. But we also have still a considerable number of students who come from Khmer or Cambodian language backgrounds, Albanian language backgrounds, and we, besides the 1 and 2 kinds of languages, we have several where we have 5 to 10 kids speaking different languages. So that's a unique piece of our program as well. I saw some questions about how many students participate in these programs. In Janesville, when we look at students who are currently receiving services, it's probably just under 700. When we start thinking about, we don't identify kids until kindergarten. We also have a number of 4-year-olds that we know their home language survey says they're potentially English learners, but we provide support, but we don't evaluate them till kindergarten. And additionally, we have probably close to 350 students who are former English learners who have exited the program and are now fully proficient. So there are a lot more multilingual learners in our schools than those that are receiving services.
Thank you, Julie. I have a quick question. Do you engage your former English learners to come back and mentor students, their current English learners in your program?
We don't have a formalized way of doing that. It might occur somewhat organically in like our heritage language programs for Spanish. But yeah, that's a great idea.
And then if either or both of you could speak about, we focus so much on language, but the cultural aspects that come along with that, and how do you intentionally integrate students' culture into the learning experience and sharing that with students that may even be outside of the program?
So I'll wrap up and then I'll let Rosa Maria go. I would say in general, as a district, we are doing our best to be culturally responsive and to include more materials that are mirrors and windows for all students. Our EL teachers do a lot to recognize and bring in and try to, the rich resources that the kids bring with them, to build on those and have an assets-based model, in including, when we're picking new textbooks and things, we're looking for diverse authorship. So multilingual classroom libraries, we're looking for representation. We're looking for, parents coming in to share things that they know. However we can bring that in and validate that is hugely important to us.
And similarly to Julie, with trying to diversify our book collections and, just having the dual language program and the requirement of the teachers needing to be bilingual. Many of them come and they have Latinx background, they're Hispanic. So they do share the culture with the students, with the school as much as they can. We recently, a couple of years ago, added bilingual homeschool liaisons. So they're people who are, paraprofessionals, they work in the schools, but their primary job is to connect families to the school as well as promoting the culture in the schools. That's been going pretty well. I mean, it's a process, and but what I've seen over the last few years is that there has been an increased focus on culture and promoting that within the schools. And for example, this year we had our Hispanic Heritage Month, which was a month long, many different activities, and many of the students, anecdotally from the program, our homeschool liaisons and from the teachers, a lot of the students started becoming interested in like Spanish, or telling their going by the dual language teacher and saying, I know, I learned about this today, or things like that. So it's been nice to see that change, but it's it is a work in progress.
Perfect. As a parent of 2 DLI students, I can say just the capacity that both of our children have, just as far as their pronunciation, their exposure to language and culture. I see it as a huge asset. So I am definitely grateful for the programming in School District of Beloit. And I'm glad to see that other districts around our county are having amazing experiences for students as well. So ladies, thank you both for joining us. Steve, I see that you put a question mark in the chat. Please go ahead and unmute.
Yes, has trauma been a significant factor in the students? You mentioned, some refugees. Has that thrown in the additional complications that need to be addressed?
Yes, I would say so. My teachers could speak to that even better, but when we do have students coming out of some very difficult circumstances and dangerous journeys, trauma is a factor. And so you're looking at all of those pieces together, the general culture shock, the additional trauma, what we've seen with some of these students from Honduras, that's new to us, even those of us who have been working in EL or bilingual programs for a long time, are more students with interrupted schooling. So second graders who have not been to school before, or 10th graders who haven't been to school since 7th or 8th grade and have never used a computer before. Those are all presenting additional layers of complexity.
I think one thing to keep in mind is that the vast majority, I haven't checked my stats recently, but over 95% of our English learners are born in the United States. But, we do, to parents who are immigrants, that's mainly who our population is now. It used to not be that way 10, 15, 20 years ago, but it is our reality now. But we do have a lot of students that we've noticed that have been coming from Central America, and, added, especially at this time, adding asylum seekers or refugees coming to our area, COVID on top of that, and not knowing how to navigate the system. We were remote for 3/4 of the year last year. That was difficult, and being here at central office and by welcoming families into the office, and, where we had our protocols of you need to socially distance and things like that. But we had a lot of families trying to come in and wanting to connect to the internet and offering them these hotspots and all these resources that they could use with their students, and then taking the time to teach them how to use it. That was a struggle as well. But and then on top of that, not knowing the language, just how do you communicate? Well, physically, and so sometimes to be able to communicate with things that the students are not okay with, sometimes they do turn a little bit, where they do get a little physical sometimes, but not everyone. It's just, and there's a lot of needs out there, where we have high schoolers who get to us in junior, senior year, and they're already 17, 18 years old, and trying to help them graduate when they, come here as asylum seekers or refugees. They don't have their transcripts with them. So we don't know what courses they've taken. So then finding other means for them to get their education, but at the same time, they're going to be adults within a year or two. And as far as the students know, that if they leave school, then that affects their immigration, opportunities. So I mean, that we've got a lot of situations like that as well.
So again, thank you, Julie and Rosa Maria. Before we move on to community service, to that portion of this discussion, what do you want this audience to know, specifically in ways that we can be of assistance to our immigrant population within our schools? How can we be helpful?
I actually think a lot of the things that you've already been working on, the housing, the food, all of those pieces, if those things are taken care of, that makes our teachers' jobs a lot easier, because they're not also worrying about stocking their room with snacks and, you know, just kids that have all of those other pieces to worry about just layers on. So the more we can have the community helping to meet basic needs, the more we can focus on actual instruction.
I agree with Julie, just those basic needs, but, reaching out and we can say it over and over and over again that, signing up for services isn't going to expose you to ICE or anything like that. It's just, people wanting to help and creating that safe feeling of safety to be able to help them navigate the systems and get the services they need. But I definitely agree with Julie, basic needs so that they don't have to worry about it at school.
So ladies, what I'm hearing is that what community can do to help is work on helping families attain those basic needs so teachers can focus on teaching, which I clearly support. And that was a great segue into talking about community services. We are so excited to be joined by Kate Luster of Rock County Human Services, Anna Bowden of ECHO, and Devin Dion of HealthNet. And I would love to hear from all three of you in that order. So Kate, please unmute and share with the group.
Great, thank you for having me tonight. And I also want to introduce Wendy Sanchez, who is here also from Human Services. Wendy is one of our bilingual economic support workers and is much more of an expert than I am on benefit related topics. And so I'll give a little bit of an overview here and then give Wendy an opportunity as well to share some information. So the Human Services Department in Rock County is essentially, we're in Wisconsin. We're one of the few remaining states that has a county-based human services system. So the state contracts with each county to deliver essentially those public safety net services for communities and for that individual county, residents of the county. And our programs are, you can kind of think of them as organized into 4 key categories: behavioral health and substance abuse services, services for children, youth, and families, services for aging and disability resources, and then our economic support resources that are benefits, public benefits to assist those who need them. And so the Human Services Department is pretty large. We have a very big budget and staff, about 480 Human Services Department staff delivering services across all of those areas. In terms of our services that are available for our immigrant communities, most of our services are available to anyone who lives in Rock County without additional criteria, with the exception of some of our programs that are restricted to those who are eligible for Medicaid. And there are, as I said, Wendy will talk more about kind of that benefit eligibility. So mental health services available regardless of legal status to anyone who's a resident of Rock County, and our services are really structured for those who have difficulty accessing services elsewhere in the community. And we do provide those services. So we have a walk-in substance abuse clinic, outpatient counseling, psychiatry, and then a variety of different programs for those with higher level mental health needs, including our crisis intervention unit, which is 24/7 mobile psychiatric crisis intervention for those who are needing that service. Most of our services are voluntary. We also have a portion of our services across our continuum that are involuntary, in that they may be mandated by the court depending on a situation related to safety. And so, for example, crisis intervention services are often voluntary, and then there is also the experience of an involuntary emergency detention, for example. So the Human Services Department has the responsibility for implementing those programs. We have moved recently, so those behavioral health services that I just described are organized at the Dr. Daniel Hale Williams Rock County Resource Center, which is our new beautiful building. If you haven't seen it, you should come get a tour. The DWRC, we moved in a couple months ago, and our outpatient clinic and all of our case management programs for behavioral health are organized there. And I have some brochures that have that information, but they're in the process of getting revised with our new address on them. So I can send them to Neil and Amy as they are, and just know that they're also an updated process. And most of those we have in both English and Spanish that have the contact information for these programs as well. Children, youth, and families, 2 of those key programs are in that category of what we might say involuntary: Child Protective Services and Youth Justice, for those who have been referred by the court for youth concerns about youth justice related problems or concerns, but the interventions are really family focused, focused not on punishment as much as it is on strengthening families and skill-based work with youth who are at risk. Child Protective Services is, of course, the local child welfare agency that processes our access line, complaints and concerns about child abuse and neglect, makes determinations about investigations, and then provides ongoing case management support for families as needed. And then Children's Long-Term Support is a long-term care program for kids with disabilities, a Medicaid program. And we're seeing an increasing number of families in that program. That program's really growing overall. And we're also seeing increasing numbers of families who are immigrant families, children within immigrant families, or connected with larger immigrant family social networks. And that's a great program that just helps kids with disabilities have a variety of services to help them remain in their homes. The Aging Disability Resource Center is a resource for all things connected to the aging population or adults with disabilities, and provides information, support, resources, referrals, as well as, for those who are eligible, connection to long-term care resources. And I'm going to pause there and can then hand this off to Wendy to provide more detail about economic support services. And then we'll see what questions there are for us. Okay, Wendy.
Okay, thank you. Thank you, Kate, and thank you everyone that's here tonight. I am a bilingual economic support specialist for Rock County. We're lucky enough to have a bilingual team in Rock County. So we do have a team of individuals from different countries that understand different cultural needs. So when we get those clients on the phone, which most of the time is on the phone, we understand sometimes their level of education and their level of expressing their needs, and us understanding them and being able to communicate with them in a I guess in an education level that they understand, not necessarily with very large words that sometimes they won't understand. So we're very lucky in that aspect. And we also service not only Rock County, but there's 7 counties within our call center that we service. So through our servicing, we offer Medicaid, food share, elderly, blind, and disabled benefits under Medicaid and long-term care, child care benefits, child care assistance. And so depending on the nature of the immigrant, depending on how they came here or how they got here, if they're a refugee, asylum, If some are children that are under the DACA program, the deferred, I forget what that acronym is, but that they were brought here basically as children and have grown here. And now they are receiving some type of employment authorization that allows them to work. Sometimes they're not eligible though for our for some of those services, but it's really important to let them know that even though possibly, for instance, our a big part of our population is undocumented parents that have children that are US citizen born. So sometimes the education level in our community, or the fear of some of our customers, is that they don't want to ask for fear that something's going to happen to them or their family. They're going to be taken away because they've asked for something they really need. Most of the cases, I mean, we don't refer them to any immigration or citizenship agencies. So undocumented parents are not eligible for benefits. For example, they wouldn't be eligible for food share, they wouldn't be eligible for Medicaid, but their children are. So their children are eligible for some of those benefits. So sometimes just having those resources and those pamphlets out in the community and other agencies so that they can help refer them over to us is huge. But yeah, it all depends on what the immigrant status is and which programs individuals would be eligible for, or sometimes when they would be eligible for services. For instance, permanent residents. If you're a newly permanent resident, sometimes you're not eligible for the services until you've had 5 years of residency. So there's a little bit of information that is nice to get people referred to us so we can explain to them what services we can offer them or their family. Also, we do work with emergency medical assistance as well, because we do have undocumented population that sometimes have health emergencies and they fall in the hospital and they don't have any way to get any help. I know there are huge resources out there. For instance, HealthNet is here, and I know that they help tremendously with the immigrant population. But also community health systems, that's huge for the immigrant population in the Rock County area. But definitely knowing that there are services and there are sometimes different eligibility expectations to be able to obtain those services. But knowing that they're there and that they can always call and ask and get more information is huge and important.
Perfect. Thank you so much, both Kate and Wendy, for doing a great job with outlining services that are available in our county. Next, we will shift to Anna Bowden from ECHO. Anna, please feel free to go ahead and unmute. It doesn't look like you're muted, but we can't hear you. Now it looks like you're muted. Same issue. The mute icon has gone away. So Anna, if you don't mind, we'll just flip-flop. We'll go to Devin and hear about HealthNet services, and then we'll loop back to you. Devin, thank you so much for joining us this evening. If you could talk to us a bit about the services that HealthNet offers, that would be great.
Yeah, absolutely. And thank you for having HealthNet speak here. And thanks for everybody for joining this conversation. It is a very important conversation to have. So I appreciate everybody coming out here to make some community change. So yeah, my name is Devin. I'm from HealthNet of Rock County, and we are Rock County's only free and charitable clinic. And so we provide services to underserved residents of Rock County. And so we provide medical services, dental services, vision services, mental health services, chiropractic services. You know, we provide a lot of services, and we try to be the healthcare home for people who cannot afford services, people who are uninsured or underinsured. For our medical clinic, to be eligible, you have to be a Rock County resident, and you have to live at or below 250% of the federal poverty level. And for our dental clinic, you have to be at or below 200% of the federal poverty level. And so, you know, at HealthNet, you know, we're actively trying to help the immigrant population in Rock County specifically, you know, because, well, everybody deals with health issues at some point in their life, but there are a lot of barriers that immigrants face when it comes to obtaining healthcare. You know, a common theme that I'm kind of hearing from a lot of people, which is the reality of it. You know, a lot of patients, a lot of undocumented individuals feel scared to insert themselves into these systems that they need. So at HealthNet, you know, we try to maintain a very high level of medical transparency. Both of our receptionists for our medical clinic and our dental clinic are bilingual, just to help them with that appointment making process, and also just to answer any questions that they have about the community or about healthcare. And also both in our medical and dental clinic, we do have 2 full-time translators to help them communicate with the medical professionals and with the dentists, just to ensure that medical transparency. And, you know, we also provide things like prescription assistance. Every year we give out about $1.5 million in free prescriptions. And a good portion of our patients are immigrants as well. And with those prescriptions, a lot of it, you know, we have a nice diabetes education program, because immigrants, specifically immigrants from Mexico, have a higher risk of having type 2 diabetes. You know, so we help them with obtaining those resources and helping them maintain a healthy lifestyle so that they can manage their diabetes. Yeah, and a lot of, what was I going to say? Sorry, I had a list here. Yeah, and so, you know, another cool thing that we did, you know, revolves around the COVID-19 pandemic. The COVID-19 pandemic had specifically hit lower income communities very hard. And there was kind of a lot of, you know, I'm sure as everybody knows, there was a lot of misinformation about the vaccine. So, you know, we had this COVID-19 ambassador program where we would send people out to harder to reach communities. And so we specifically sent out a COVID-19 ambassador to the Hispanic and Latino communities to help with the vaccination efforts there. And also, yeah, we just tried to maintain a very high level of transparency in our medical and dental clinics, and we're there for immigrants, and we very much try to help them out in whatever way we can, because, like I was saying before, everybody needs healthcare, and, you know, we just want to let everybody know that we are there for them. And specifically, I'm kind of connecting this with some earlier conversations. Our dental clinic is one of the only clinics that does accept Badger Care. And if people can't get, there's a lot of people out there who, you know, who are on Medicaid, and, you know, there are some practices in Rock County specifically who don't accept Medicaid, but we do accept Medicaid, you know, opening up that resource for people who qualify for those services. and very much trying to be that healthcare home for immigrants in Rock County, making sure that they're also getting preventative care. We are involved in the Wisconsin Seal a Smile program as well, providing preventative dental care and sealants towards children in the school districts in Rock County. And yeah, we try to provide a very comprehensive portfolio of services for underserved residents of Rock County, specifically immigrants, because they are at a greater likelihood of being in those low income communities, and it often comes to where they don't have, they can't afford medical services, and so we try to have as many community partnerships as we can, referral systems in place, so that if one practice is not able to take a patient, then they can refer them over to Health Net. And we're always constantly trying to expand our services to reach out to the other communities in Rock County, and make sure that anybody who qualifies for our services is able to get them.
Devin, thank you so much for giving us that overview. I've had a few conversations with Ian, so I was somewhat familiar with your services, but I did not realize that you offer chiropractic services as well. Just the first question that came to me as you were speaking, is there a wait list for services, or if a community member needs to get in, is that something that can happen within a relatively short period of time?
Yeah, absolutely. I can certainly speak on the dental clinic, and I think they run things similar in the medical clinic as well. But often they will book out times. They will book out open times for people who come in either with a toothache in the dental clinic. If someone's experiencing pain in the dental clinic with their mouth, we qualify that as emergency. So we try to block out times in our schedule, so that people who can come in, at least for those at the dental clinic, can receive those services. But as far as the medical clinic goes, I don't think that Health Net can provide these comprehensive emergency services for people. We try to be the primary care home, going to the doctor's office regularly, making sure that people have this robust schedule of getting care. But if somebody walks into the Health Net clinic, whether it involves calling 911 or providing as much treatment as we can, then we will help those patients to the best of our ability.
Thank you so much, Devin. Now we are going to circle back for questions on any of our community service providers. Anna, thank you so much for your patience. If you are able, if you could unmute and share with us some of the services that ECHO provides, that would be great. Can't hear you, but you're muted. So if you could unmute, I'm hoping.
What about now?
Yes.
Okay, so I do apologize. I'm not in a computer, I'm at home in my phone. So it's the first time that I tried this and it has been a little bit challenging. So I do apologize. Anyway, so I am very new to ECHO. So I'm gonna try my best to convey, some of the things that we do and that I have learned so far in the less than 2 months that I have been there. So ECHO, mainly we do have every day in the morning we have the food pantry. So that is one of our main things that I have gotten to know some of the Hispanic immigrants that they are in the area. That is for Janesville residents, and they can come every morning. And it is something that I think that more and more they're starting to know that it is available. One of the other services that we have is our housing assistance with rent. And that is something that One of the things that we notice is that because we also have our outreach program for the homeless and lodging, and one of the things that I have noticed for my time there is that really there aren't that many homeless, that they are immigrants in the area, meaning they are not sleeping in the streets or in their cars or in shelters. I think that the community overall, the Hispanic community, tend to maybe have more people living in a house, but not to have that many people put out in the streets. So I think that the assistance with rent is really most useful for them. And then we do have, of course, other events, like we just have our Thanksgiving basket distribution last Saturday, and we're having the Christmas toys coming up. By the way, they can still sign up until December 13th, and that is for Janesville residents too, because it's organized by ECHO Funds. And this have been an opportunity, having all of these events and things that they can sign up to, for me to contact many immigrant families that we have. And through assisting them, the things that I have noticed that they are the biggest handicaps to me are to know really what services are out there. There is a big, like they don't know that a lot of times I have tell them, yes, this is things that you can apply for this, or you can go to this person or this other community organization, and they didn't know. So I think that one of the biggest handicaps is to somehow get this information to them of what it is out there that is available for them. The other thing is the language barrier. So I have had 2 recent cases where the families had COVID. So they have incurred very, very large amounts of bills, medical bills. And unfortunately, by the time that they have gotten to me, they are now on collections. When if they would have been able to, get those bills, somehow translated or know what it was out there, they will have pretty much almost like it either reduce the bill or even not even have to pay anything. So one of them, she just told me the other day that she just kept, because I said, did you receive the bills, or did you? And she said, yes, we just threw them away. And I was like, okay, no, you cannot do that. If because they don't speak English. And one of the main things that I think that you are in a country where the language is English. So even if you don't speak it, try to reach out to some people, some of your friends that can read it, or some of the services that are available to you. But again, it's going back to what is out there that can help them. And then I think that both 2 things, knowing what it is out there and the language barrier, I think that a lot of that has to do with trusting. And it's something that we have heard before during different people in this conversation is some of them, they are afraid that by coming to these services, they are gonna be, referred to immigration or customs, or somehow their names are gonna come up in some paper that they don't want to be at. And so it is very important to develop that trust and that rapport with them, that they will trust that what we are doing is really, just for them. We're not going to share their information with anybody else that doesn't need to know. So yeah, those are for me some of the biggest handicaps. I am very excited because even though, I'm an immigrant myself, I'm from Spain, but I have a very privileged life. So I cannot even imagine what some of them have gone through, but it is really my intention now that I'm in ECHO to try to really help them as much as I can and offer those referrals and services, even if ECHO doesn't provide them, but at least to be able to direct them to the right, organizations and services that are out there.
Well, Anna, thank you so much for your resiliency. I'm glad that we were able to hear from you this evening. So I'm going to start back at the beginning of all of our guests in the area of community service and ask the same question that we asked of our education professionals. What is it that we as an audience can do, and what can we share with our circles of influence, how we can be helpful? So Kate and Wendy, I will start with you from the county perspective. What do you want people to know about services, about how we speak about services that are available, and what can someone who's wondering, what can we do to support this effort? How could we be helpful?
I think what's most helpful is sort of a two-way dialogue that comes to mind for me. It's helpful for us to know what we can do better to be available and accessible to our immigrant residents. And I think that we would ask that those of you who are sharing information with this population can reach out to us with questions, or direct folks to reach out to us with questions about what we can help with. It is very real, the theme that we've heard about the fear around engaging with services is very real for a government human services department. And it is also true that we don't have the flexibility because of our funding and our kind of regulatory structure in most circumstances to not document people's information. And if you're going to be receiving services, we don't have as much flexibility as other entities might around the information that we collect, and we don't use that information in any way that reports to entities that would be concerned about. We're not concerned about legal status, and we don't report to those who are. And so I think sharing that message about the safety and accessibility of human services programs is helpful. And then giving us direct feedback about ways that we can be engaged or more available and accessible in individual or broad situations.
Perfect. Wendy, did you have anything to add to that?
I would agree with Kate. Yeah, and us knowing as much as what's needed or what we can do better is definitely something that we do need. But yeah, any other organization that has the opportunity to refer them, just to give us a call. Like I said, we have a team of 5 bilingual workers who culturally have understanding of the nature of a lot of our clients and the fears that they hold when they're calling to request any services. So referring them over to us, even if it's just for a question, if they don't want to give us lots of information, but we can give them some information about the services we offer, and then they can decide from there, but not keep them out in the closed world without knowing that these services exist.
No, that's helpful. I just want to bring attention, Renee, thank you for putting that information in the chat. I'm not sure who has their chat open or not. But there is a community resources for Latinos meeting. If you would like to participate, please do reach out to Renee. Renee, thank you for putting your email there. But the next meeting is going to be Monday, March 14th from 9 until noon at the Hedberg Public Library. Renee, if you don't mind unmuting, are these meetings usually held quarterly, or what is the structure and cadence of those meetings? And who is invited to attend?
Thank you. They are twice a year meetings, always March and September. And the meetings are not open to the general public, so they're not meant for your clients to attend, but for people who are service providers who offer services to Spanish speakers. In 2022, it'll be our 14th year of holding these meetings. So one of the things, the reason I always like to mention those meetings is because a lot of organizations have turnover in their staff, and then I don't find out who the new person is, and they don't get an invitation. And so I really want to make sure that people know about these meetings, so that if I don't already have you on my email list for them, that you will, I can add you, but I need your information in order to do that.
Perfect. Thank you, Renee. And hopefully people who are providing services will reach out so that they can attend and become engaged in that programming. So next, Devin, same question. How can we be helpful? What information would you like for us to share with others that would be helpful to your immigrant clientele?
Yeah, absolutely. I think that, you know, kind of a similar response would just be letting people know that these resources are available to people, and that, you know, they don't have to have any fear of any sort of consequences from that, other than, you know, getting the healthcare that they need. And I find that one thing that has worked tremendously is that community outreach. You know, just going into the communities and letting people know and say, hey, you know, this is something that you can utilize. You know, when you're at, you know, because I think that often, you know, healthcare especially comes up in a lot of different veins of conversation, right? If it's at psychotherapy, if it's through the crisis line, saying, you know, I've been dealing with this, you know, my son is dealing with these health issues, but I don't know where I can go. You know, just having that conversation with them and saying, hey, you know, this is a resource that exists to you, right? I think that honestly, you know, having those conversations and having that community outreach can very much connect people with the resources that they need.
Sounds good. Thank you so much, Devin. Anna, I did not realize how new you were in the role, and it sounds like you're already off to a great start. How can we support? What messages can we share about services provided at ECHO that would be helpful to bring in more people who need to connect to the services that you provide?
So I think that one of the main things for me is it's not only inform them about what ECHO is about, but also to provide the right information. So if any of the other organizations or services, if you guys are not sure, you know, will ECHO will do this or not, just give us a call. You know, we are always happy to be able to, you know, provide that information, because sometimes it's very disappointing when we are not sure, you know, when we get a client that thinks because some other organizations say, well, ECHO does that, and then now we have to say, well, no, we really don't, you know. So that's one of the things that I am kind of like trying to do myself. You know, I have met with Renee, I have met with Gina, I have met already with Jacqueline from Children's Wisconsin. I am trying to really learn what is out there, so when my clients come, I can give them right information, because they are stressed out enough with all that is going on in their life for me to give them, you know, information that may not be accurate. So, you know, to everybody out there, if you guys want to know more about what ECHO is about, then, you know, just give us a call.
And I thank you so much. That is a critically important reminder. We don't want to overpromise on any entity's behalf and then have clients show up and be disappointed or frustrated or throw up their hands and walk away without receiving services that are available that could be helpful to them and their families. So thank you so much for that reminder. Neil, I'm going to put you on the spot a little bit. You put something very interesting in the chat, and so I would ask that you unmute and expound on that a bit.
I've just been reading this book, which you won't be able to read on in the picture, but the information is there. It's called You Welcomed Me, Loving Refugees and Immigrants Because God First Loved Us. And I've been reading it in little bits, and the little bit that popped up last night, coincidentally, was what I just put in there. And the point is that, and as I was talking to Stan Milam at 4 this afternoon about this program, he also raised the question, what about all the fears that people have about immigrants? Whether they're going to take jobs away, whether they're going to drain social services, that sort of thing. And the important thing is to actually listen to people's fears and to identify that we all have some fears in us that we need to confront and deal with. And so the point of this particular passage was, let's identify that the biggest stumbling block in welcoming immigrants is the fears that we have in our own thoughts and feelings, and overcome them by an effort that we make. Does that make sense?
Not only does it make sense, but I'm going to categorize that as a very valid point. And I would like to explore that a little bit. So as we think about immigrants, and this is Courageous Conversation, so we typically center all of our discussions in race. So as we talk about dealing with racial and ethnic diversity, and in this case, specifically immigrants, from our education systems to our health systems to our systems that provide countywide services, what internal training or evaluation is done to make sure that the staff that is working with this population and with others who are racial and ethnically diverse, that there isn't that unconscious bias, that there isn't that othering when we're working with people, that we are consistently showing respecting humanity and compassion. So what are those intentional things that are being done to make sure that we are providing quality service for all of our community members? So I would love to hear from everyone. So from our educational sector, Rock County Human Services, from our healthcare field, from ECHO, but feel free to just, I think we're a small enough group, we won't be trampling over each other with our comments. So feel free to unmute and go ahead, please.
I think one thing that we've come across in our district, not in large numbers, but enough to bring attention to it, is that some of our families coming from Central America, their first language might not necessarily be Spanish, maybe an indigenous language. So that, even if you have Spanish speakers on your staff, understanding that some of our families might not necessarily speak Spanish as a first language. So that patience and that, exploring that further as an organization would be important. Definitely has given us a little bit of a learning curve here.
Thank you, Rosemary. I appreciate you being transparent about that. So just to help with the flow, Julie, since we're on education, is there anything else that you would add about intentional things that Janesville is doing?
I guess I would just say that with staff, usually it's not so much that they don't want to do the right thing. It's that they get scared about their own capacity to work with children who don't speak English or very much English. And so helping them to understand that it's a process, that it takes time, and to boost their confidence in what students are learning, is helpful, giving them more strategies, building relationships with them, giving them some experiences and helping them to understand, culture and language is part of it. In addition to that, I would say all of the pieces that we're working on with staff about, anti-racism, because when we think about that intersection of immigration and racism, we know that people perceive immigrants who are brown and Black very differently than they perceive immigrants who are coming from Northern Europe. So I think those intersections are really important places.
Julie, I completely agree, and thank you for highlighting that. We'll move over to the county, Kate and Wendy, if there are intentional things that the county is doing to make sure that there's consistency of service, that unconscious bias, et cetera, are being addressed. We'd love for you to share those.
Sure. I guess what I would say is that in some ways, I'd like to think that as a Human Services Department, we should be, and I think we are most of the time, well situated around a key part of our mission that is just about honoring the dignity of all people, period. And so we talk about that as a core component of our mission, and really trying to kind of stay connected to that value. And in that way, many of our staff who are committed to the values of the social work profession or their social service are oriented toward that. And we are also, so we try to be mindful and remind ourselves to be grounded in that mission about the dignity of all people. And we've been really for the last several years prioritizing professional development and organizational culture around diversity, inclusion, and equity, and hold also, in addition to that mission statement, diversity and inclusion commitment statement, which is very clear that we recognize that bias exists in all of us and that we are working to have self-awareness about where that shows up. And so I think that continuous regular conversation about that, which is happening increasingly within our organization, creates a culture where that is an expectation of those who are working, and also creates an environment where it's okay to talk about those things, to struggle with them, to learn more, and to grow about our biases and where they play out. So Wendy may have something more to say about that based on her specific experience in ES.
Yeah, it's been great. We've done so many different trainings and things that Human Services brings to us every year. Cultural competency, trauma-informed care. Within ES itself, we have had courageous conversations. So that does bring to the floor and open up our entire unit to share if they want to share, or not share if they decide not to, but to try to understand some of those unimplicit bias and things that we sometimes could be doing without even acknowledging that we're doing it. So I think that we're very lucky as the county and as a department ourselves with the types of trainings that we get that help us with our clients.
Perfect. I'm just thinking through, and I'm so happy to hear the things that you are saying, but if I am a client who had a negative experience, but I still need you for support and services, would I share that information? So it may be helpful to kind of think through how we get that honest feedback without our clients feel like they're jeopardizing their services or the level of care that we provide, and then how we track that, because what gets tracked either is important or becomes important. So just some things that I was thinking about as both of you were sharing. Devin, it looks like you are going to have the last word on this before we move to announcements. Anna did put in the chat a couple kind of final remarks, but did mention that she did need to get off the call. So Devin, please share.
Yeah, absolutely. I think one of the most I think one of the most important thing that, that HealthNet is doing to, to try and combat this issue is, making sure that people are comfortable in the healthcare setting. I mean, I remember when I was a kid, I was scared to go to the dentist, which is a common fear for a lot of people. And, I had a conversation with my friend recently, and it really just struck me. She was an immigrant from Southeast India. And, she told me, she was like, when it was in the therapy setting, and she was like, for some reason, I just feel comfortable. This is the way she said, she's like, I just feel more comfortable, going to therapy with somebody who looks like me. And I think that just really opened my eyes to this issue that, talking about how these biases exist in all of us, not only in the providers, but also in the patients as well, and talking about meeting the patients where they are at. And that's why, HealthNet tries to have, that's why HealthNet has 2 full-time translators, just to help them get comfortable in that healthcare setting, which can foster this long-term effect of being more comfortable in the healthcare setting. So, that's one thing that HealthNet is trying to do, and, maintaining a very diverse staff, so that people can be as comfortable as possible in the healthcare setting.
Devin, thank you so much for sharing that. I did just drop an item in the chat if anyone wants to explore. It's less local and more national, but I found it's kind of like a primer for how our immigration system works. Warts and all, etc. But it will give detailed information about the different types of immigration, how the system is supposed to work. And then feel free, the chat is a treasure trove of resources to reach out if you have specific questions. I do have one announcement. As many of you are aware, YWCA Rock County have participated in the creation and the release of the Race to Equity Rock County report, addressing racial disparities to build a foundation of racial equity. So the link to the report is there. It is Rock County specific. It covers education, well-being, health, and deep-end systems, which are considered juvenile and adult criminal justice. So please do read that report. I have one other exciting announcement, is that our Lunch and Learns for 2022 will all be centered around the Race to Equity Rock County report. We usually do winter, spring, take the summer off, and then do fall. We are bringing summer back, so we will have 4 Lunch and Learns for 2022. Dates to be announced shortly, so please keep an eye on our social media and our website. But we will break down each of the 4 areas of the report and do a deep dive. If your organization is interested in having a one-on-one with me to process the report and what it may mean for your organization with your work group setting, I am more than happy to do that. So just please reach out. Email is the best way to get in touch with me. But yes, the report was a labor of love. So please do take time, begin with the section that is more pertinent to what you do. But please do read all of it at some point. Neil, I yield the floor to you. Are there any Diversity Action Team announcements before we move to the parking lot?
I confess to not knowing the schedule for December, but I do want to remind everybody that the 15th of January is the Martin Luther King celebration, and the YW is hosting that online again this year. And so at noon on the 15th of January, we will be hearing more about that, but you can use that as a place saver on your calendar. The other thing that as an IT newbie that I always need to be reminded of is how to save the chat. So there, as Amy says, there's a wealth of information in the chat, but I can't write that fast. So the way you save the chat is you click on chat, and there will be a sidebar beside all of the pretty pictures. And then at the very bottom, to the far right, there are 3 dots just to the right of the emoji. And if you click on the 3 dots, then it says Save Chat. And you click on Save Chat and it's saved. Then you have to sort of figure out where to find it in your computer. But I think it's going to be under Zoom somewhere. And it will be labeled exactly what it is. So it won't be hard to discover which one you're looking for. Anyway, that's a piece of information.
Thank you, Neil. So if you could, as you do so well, close us out, and I will end recording, and everyone is welcome to stay for the parking lot, which Neil will explain while I'm ending the recording.
Parking lot